Hello everyone and welcome to another video. If you're about to go on your first clinical experience, there can be a lot of questions that come around it, such as how to approach it and what to expect, especially when each clinical instructor and site is a little bit different. In this video, I'm going to go over just a few questions that you should make sure to talk about with your clinical instructor on the first day to ensure you have a smooth clinical experience. The questions we go over today will not be just basic logistical questions, but rather ones that will help you improve communication between you and your CI, as well as help set expectations for the experience as a whole. Those logistical questions such as schedule, parking, time of arrival, and everything like that should be done before your experience starts. With that being said, let's get into the 5 questions we will talk about today. Question number 1. What does an average day in the clinic look like for you? Question number 2. How do you expect for me to progress through my experience with you? Question number 3. How and when do you typically provide feedback to your students? Question 4. If I have a question during a patient encounter, when is the best time to ask it? And question 5. If I don't feel comfortable with something, how would you like me to communicate that to you? For each question, I will go into a little bit of detail on why it's important for you to ask each of these questions on day 1. So let's get into it. Question number 1. This one is important because it will give you some insight into exactly what your days will kind of look like, how many patients you might expect to see, what time or times documentation occurs throughout the day, as well as how you end the day overall. Question number 2 is a very important one because it allows for a conversation to occur about attainable goals throughout your experience. Now, if your CI answers this question with something like, I want you to be taking on 100% of my course load by week 3, and it's your first clinical experience, that might be a good opportunity for you to kind of transition in and be like, hey, this is where my knowledge base is at right now. I feel comfortable on these subjects, as well as this is where my school expects me to be. Say, if you're only expected to be an intermediate student physical therapist at this point in time, then that would be something to communicate with them at this time. Overall, it allows you to make sure that you feel comfortable with the goals that your CI is setting for you, as well as make sure that your CI and yourself are on the same page. Similarly to question number 2, question number 3 provides another chance for you and your CI to sync up on exactly what you're thinking. If you prefer to have a certain type of feedback, this would be a great opportunity to explain that. Or if you like a particular timing, say you prefer that you receive feedback in the middle of you performing a skill so that you can adjust along the way, or on the other hand, maybe you prefer to have your feedback afterwards so that you have time to think about it, look back on yourself, and be able to adjust from there. This is really important because it just allows you to be on that same page, and it really reduces the amount of frustration you might get when you receive feedback at a time that you weren't expecting it, and just helps you, again, be on that same page with your clinical instructor. Now, this 4th question is more so for your clinical instructor in providing them an opportunity to prevent some maybe awkward situations while you're in a patient encounter, especially in some populations where students are not expected to be within a particular clinic. It can allow your instructor to explain a little bit about their population, as well as possibly the subject, because sometimes you're talking about touchy subjects within your encounters. So this just allows your clinical instructor to outline exactly when is a good opportunity. Say if they're more comfortable with students asking them questions throughout a patient encounter, or if they prefer to have it be done outside the room without the patient present, this would be their opportunity to kind of provide you that, and something for you to take note of as you continue through your experience. Lastly, obtaining the answer to question number 5 can help make sure that good, smooth transitions can occur when you feel uncomfortable or not as confident on a certain technique or explanation, that then your clinical instructor knows to kind of step in and make sure that they can help out. Because in situations where a plan isn't in place like this, you can run into periods of long silence or confusion between you and your clinical instructor, which isn't the best for the patient as well, because then they lose a little bit of buy-in or confidence when it doesn't seem like you and your instructor are on the same page. So by having this established, it will just make the experience better for everyone, the patient, you, and your instructor as a whole, because then there will be this better perceived confidence even during those transition points when you don't feel as confident yourself. These 5 questions should help you set a solid foundation for both your expectations throughout the experience as well as your communication between you and your clinical instructor. It doesn't take very long to ask these questions, but as I've experienced myself, it definitely helps and makes the experience more comfortable as a whole. If these questions were helpful, please make sure to hit that like button. And if you want to see more content from me, such as day in the life, stereotypes, how-tos, and much more, then make sure to subscribe as well. Thank you so much for watching. This has been KBDPT, and I'll see you all in the next video.